If you or anyone you know is suffering from moderate to severe pain, we have a solution brought to you. Oxycodone. Trade names can be Oxydo, Oxycontin, Oxy-IR, Oxy-NEO, Roxicodone and Supudal. Under the drug classification, opioid analgesics. Pharmacokinetics is that it is absorbed from the GI tract then widely distributed. In fetal circulation, it crosses the placenta, it enters breast milk. It is mostly metabolized by the liver by the CYP3A4 isoenzyme. Opioids work by binding to opiate receptors in the central nervous system, which leads to a change in the way pain is perceived and the way the body responds to painful stimuli. Additionally, opioids cause general depression in the central nervous system. The result of these actions is a reduction in pain.
Hey boss, sorry I couldn't call in early, but I'm feeling in a lot of pain right now and I couldn't come into work.
Hi, I'm your nurse today and my name is Stephanie. How are you feeling?
I'm feeling a lot of pain right now.
If you were to rate your pain on a 1 to 10 scale, what would it be right now?
I scale this pain in around like an 8.
Oh, okay. I did bring the oxycodone that the doctor prescribed for you.
What is it?
It is an opioid medication that decreases the severity of pain without a significant alteration in your level of consciousness or respiratory status. So before you take it, I will just let you know the adverse reaction of this medication is confusion, sedation, dizziness, dysphoria, euphoria, floating feeling, hallucinations, headache, adrenal insufficiency, unusual dreams, blurred vision, diplopia, meiosis, respiratory depression, including central sleep apnea and sleep-related hypoxemia. So try to avoid driving and other activities requiring alertness until your response to the medication is known. And if you do stand up, try to do it slowly as it can cause orthostatic hypotension. And watch out for constipation, dry mouth, choking, GI obstruction, nausea, vomiting, urinary retention, and taking the trade name Oxycontin tablets, empty matrix tablets named Pure and Stool, and do avoid alcohol and CNS depressions with this medication, and let your health care professional know of all the RX or OTC medications, vitamins, or herbal products being taken, and consult healthcare professionals before taking any new medications. And your skin might feel flushing and sweating, and there is a possible of physical dependence, psychological dependence, and tolerance.
Okay, just give it to me now.
Okay. Would you like it with some milk?
Yeah.
During Peter Parker's right to evaluation, oxycodone relieved his pain, which was within moderate to severe level. His level of consciousness or respiratory status was not significantly altered. Now he is able to return to work. Nursing considerations may be administered with food or milk to minimize GI irritation. Explain therapeutic value of medication prior to administration to enhance the analgesic effect. Regularly administered doses may be more effective than PRN administration. Analgesic is more effective if given before pain becomes severe. Co-administration with non-opioid analgesics may have additive analgesic effects and may permit lower doses. Oxycodone should be discontinued gradually after long-term use to prevent withdrawal symptoms. Extended release. Take 1 tablet at a time. Swallow extended release tablet whole. Do not crush, break, or chew. Taking broken, chewed, crushed, or dissolved extended release tablets may lead to rapid release and absorption of a potentially fatal dose of oxycodone. Dose should be based on 24-hour opioid requirement determined with short-acting opioids then converted to extended release form. Do not use Oxydo for administration via nasogastric, gastric, or other feeding tubes as it may cause obstruction of feeding tubes. Important nursing consideration. Oxycodone is a drug with known abuse potential. Protect it from theft, and never give to anyone other than the individual for whom it was prescribed. Precautions and warnings: do not confuse short-acting oxycodone with long-acting Oxycontin. Do not confuse oxycodone with hydrocodone. Do not confuse Oxycontin with MS-Contin. Contraindications: use cautiously in head trauma, severe renal or hepatic disease, hypothyroidism, adrenal insufficiency, alcoholism, seizure disorders, undiagnosed abdominal pain, prostatic hyperplasia, difficulty swallowing or GI disorders that predispose patient to obstruction, lactation. Avoid chronic use. Prolonged use of opioids during pregnancy can result in neonatal opioid withdrawal symptoms. GI risk of respiratory depression in older adults, children younger than 11, safety and extended release products not established. Thank you for watching.